Spina bifida is one of the more common causes of serious disability in school-aged children. In spina bifida, while the fetus is forming, there's a defect in the spine where the spine doesn't close completely, and so part of the spinal cord is actually exposed through a hole in the baby's spine. Approximately 8 babies a day are born in the United States with spina bifida. We're not sure exactly what causes it. We know there's some genetic factors as well as some potentially environmental factors, but we don't know how to prevent it. Babies born with spina bifida have varying degrees of spina bifida. The most severe are born with an open lesion on the back where the spine is actually protruding. In the most severe form, a myelomeningocele, the spine comes through the back and the nerves actually get damaged, and these babies are born with paralysis of their legs. While they close the lesion in the back shortly after birth, the damage is permanent, and babies with spina bifida have problems with urination. They urinate, but they don't completely empty their bladder, which leads to recurrent and chronic kidney infections, which can lead to kidney failure, and these kids end up with PICC lines and all sorts of problems if they don't address their urinary issues. One of the ways they treat the urinary retention is with a vesicostomy. It's an operation where they open the bladder so that it comes outside of the child's body just below the belly button, and then the bladder is emptied completely. Once a child has a vesicostomy, they will empty their bladder completely into a diaper. They'll have no control over their bladder because there's no sphincter, and so someone will have to take care of changing their diaper for them. The child will wear a diaper larger than a normal size diaper for them so that the diaper will go up higher and cover the vesicostomy, because otherwise when they crawl around, the diaper will go down and urine will leak all over the floor and the clothes. So the diaper should be changed whenever it's wet or whenever the child lets you know that it needs to be changed. The child will also be incontinent of stool. Viscostomies vary in how they look from child to child, but usually it's a small opening just below the navel that should appear red. You always want to check for any sort of breakdown around the opening. Many babies with spina bifida have hydrocephalus as well, and this is a condition where the spinal fluid in the brain is not able to drain correctly, and so the spinal fluid builds up in the ventricles of the brain and causes swelling, and because the skull is solid, the brain becomes damaged if this is not treated immediately. In a child with spina bifida, the ventricles start to become enlarged and put pressure on the brain, damaging the brain. So early on they put a shunt in the brain to drain off that extra spinal fluid. The shunt is placed shortly after birth. It goes into the ventricles, has a little valve to control the pressure, and then the shunt is threaded from the brain all the way down into the abdomen, and so the extra spinal fluid goes into the child's stomach. So this shunt is really long when the baby's little, and it coils around in their stomach, so when they grow they don't have to replace the shunt every time the kid has a growth. A shunt malfunction is a serious medical emergency. So if the child becomes irritable, complains of headache or neck pain, has difficulty with balance, is lethargic or particularly tired, or vomits, has a change in level of awareness, fever, noise sensitivity, strange things going on with their eyes, loss of consciousness, and seizures, it's a medical emergency and the child needs to go to the hospital immediately. Call 911 for seizures or loss of consciousness. Report any injury to the head or abdomen to the parents immediately, and vomiting is a special concern. If the child vomits at any point you want to notify the parents immediately so they can decide if they need to take the child to the hospital or how they want to handle the vomiting. But call the parents immediately for any vomiting in the child. The child will use a wheelchair for mobility. She can get out of the wheelchair on her own. She can get out of the chair at the desk on her own, but she cannot get back in the chair without assistance. Check her knees for skin breakdown, since she'll be crawling on her knees, and help her get back in the chair as needed. She will verbalize when she needs to be changed. People born with spina bifida have an 18 to 40% chance of developing a latex allergy, so we try to avoid contacts with latex to decrease the chances of developing sensitivity. No band-aids with latex, no gloves with latex, no erasers with latex, no balloons with latex. And we always want to keep an eye on any child who's immobile skin, checking for skin breakdown. Help them move as much as possible and encourage them to move as much as possible.